Otitis media. The word otitis media is derived from Greek word, which stands for ot means ear, itis means inflammation, and media means middle ear. So, otitis media is the infection of the middle ear. When we come to the anatomy, ear has three parts: the outer, middle, and inner ear. Each has different function. The main function of the outer ear is to collect and transmit sound to the middle ear. There are three small bones in the middle ear called the malleus, incus, and stapes. And the middle ear will amplify the sound, and the sound will move and vibrate the head of the stapes, and subsequently it will cause the cochlea and the fluid to move. And this movement will be transferred to the part of the brain where it will be perceived and interpreted. To understand otitis media, it is important to understand the anatomy of the ear, especially about Eustachian tube. It is a tube that communicates the middle ear with the nasopharynx. And its main importance is to maintain and control pressure balance between the middle ear and the environment. It's also important to drain mucus from the middle ear. There is a basic anatomic difference between adult and children's Eustachian tube, which is: first, in children, Eustachian tube is shorter; second, it's wider; third, it's horizontal. The other reason is, in children there is more adenoid tissue. Because of these reasons, otitis media is more common in children, which is because if there is upper respiratory tract infection, it can easily go to the ear through the Eustachian tube. The underlying pathophysiology for otitis media is usually partial or complete obstruction of the Eustachian tube. And if there is obstruction, as you know from your pathology, behind that obstruction there will be bacterial overgrowth and inflammation. To describe simply about otitis media, the first step of otitis media will be obstruction, second there will be infection, third suppression, fourth resolution. And if there is no treatment, there will be complication. Risk factors for otitis media. It's common in children: cigarette smoking, male sex, family history, bottle feeding, and pacifier use. And also in cleft lip and cleft palate, otitis media is more common. The most common identified etiologic factors include Staphylococcus pneumonia, Haemophilus influenza, non-type 1, and Moraxella catarrhalis. Otitis media can be classified as acute otitis media, chronic suppurative otitis media, and otitis media with effusion. Acute otitis media. It has acute onset in tympanic membrane become red, and bulged, and fever, ear pain are the most common manifestations. Chronic suppurative otitis media. The duration is longer, and the eardrum will be ruptured, and there will be otorrhea. There will also conducting hearing loss, and remember that it will subside after perforation, and sometimes the fluid may remain collected and it become otitis media with effusion. And otitis media with effusion is usually asymptomatic. Clinical features. There will be fever, otalgia, otorrhea, conducting hearing loss. This is because the stiffness of the bones. And in children, usually there will be upper respiratory tract infection, and ear pulling are the most common features. Diagnosis. Otitis media can be diagnosed clinically, but the physician can use otoscope, which is an instrument used to visualize your ear. The features on otoscope depends on what types of otitis media you have. In case of acute otitis media, the membrane become inflamed and injected, and there will be absence of eardrum mobilization. In case of chronic suppurative otitis media, eardrum become ruptured, and you can see a pus coming through the perforation. Otitis media with effusion. There will be no sign of inflammation and infection, like redness and injection. And sometimes there may be complications of otitis media, and it can be classified as intracranial and extracranial complications. Treatment. Usually we use antibiotics like amoxicillin, analgesics, local heat, decongestant drop, and ear toilet. And sometimes myringotomy or a surgical opening of the eardrum is required with indication. For example, if there is bulging of the eardrum and severe pain, and second, if there is